Hey everybody, this is the Wellness Plug TV with Nadya By Nature. I am here today with a special guest. And I'm always saying all my guests are special because they are. They're special as who they are and what they do as entrepreneurs and how they take care of our communities in the wellness department, right? Y'all know that's what we talk about. So because we are the Wellness Plug TV. So I'm going to let her introduce herself a little bit and then we're going to get into the interview.
All right. Well, Nadia, thanks for having me. I'm so glad to be here.
Yes,
Um,
ma'am.
I'm Dr. Danielle Bailey, and I am a pelvic floor physical
Mm.
therapist and functional medicine practitioner here in the DFW, with two locations, one in Plano, Texas, and Dallas, Texas.
Wow.
And our goal is to really provide quality health care for the whole you. So I truly believe that when someone comes into the clinic, they don't just come in for the symptom. There's other things that are going on.
Right.
So we work together to find out the root cause of what's going on so that people can feel well and we can really get to them to a place of healing. And so that's our goal with every single client that we serve. We specifically work with clients that deal with some form of pelvic floor dysfunction.
Mm-hmm.
Floor dysfunction is the fancy word for if you have issues with peeing on yourself when you cough, sneeze, laugh, exercise, or maybe you have pain with intercourse, maybe you just had a baby or you're postpartum and you are experiencing some type of pain or discomfort, we can help support you. And so that's what we do with pelvic floor. And we work with a lot of women in particular that also deal with some form of ailment that's bothering them or that has been bothering them for a long time. Maybe they've had some hormonal issues or gut issues. We work together with them to really help them find the root cause of their issues. So that's what we do. The name of my company is 360 Health and Wellness Services. And we just really take joy in really being able to serve people at a deeper level.
And see, that's a lot more than what I expected. I was thinking that it was just subjected to one thing, like you said about when people have babies. When they have babies, that's of course something that I've realized that we're not educated in that department. I remember being at a doctor's appointment, and they mentioned, you have to have good pelvic health, in order to even, carry the baby, right? And so I remember a family member, she had to get stitches and something to hold herself up in order for her to carry the babies.
Oh, wow. Okay. Yeah. Yeah. It covers a wide range of different types of issues. People come in for a, a wide range of things, which is so awesome that we get to serve so many people that deal with issues that affect the pelvic floor. Yeah.
So, how did you get into this?
So I had an interest for pelvic floor physical therapy when I was in physical therapy school. My last semester, we had a little section on pelvic health, and I was able to shadow one of our faculty members at our clinic. And through shadowing her, I was able to, really discover that, oh my gosh, this is something I think I really want to do. But after graduating from school, I never really pursued it right away. I took, jobs at other clinics, hospitals, things like that. But there was one hospital in particular that I started working at here in the DFW, and a friend and coworker at the time said, "Hey, I think you'd really like pelvic health. You should consider doing it." And so that's what I did. I shadowed her, and then there was another coworker who was going on maternity leave. So I was able to cover for her while she was gone. And it was through that experience that I was like, this is my jam. This is what I do. And I want to do this. So that's how I got started into pelvic health.
How long? Tell me, how long ago was that?
So I've been a therapist for almost 13 years. And I've been doing pelvic health for about 7 years. Yeah.
Wow, that is a long time. So, when you see these clients, is it an age gap? Because that's my curiosity. Like, is there an age gap? Like, because I know younger women that have pelvic issues. And I know older women that have pelvic issues, like you said, that may have issues with holding their urine and stuff like that. What have you seen, or what's your oldest and what's your youngest?
So the youngest patient I've seen was 12 years old. Yes, as 12 years old was my youngest patient, and my oldest patient was 92. So it can range. I mean, depending on what's going on, no one presents themselves the same. Everyone's different. So yeah, I've seen a kiddo, and I've seen a person in the geriatric group of clients. Yeah.
So for someone older like that, you would automatically think that they're going to have those issues later on anyways.
Yes.
So
Mhm.
yeah.
Well, as we age, there are things that change in our bodies, our hormones change, and that really does affect our pelvic floor. But even if you're 92 years old, you don't have to be peeing on yourself all day long. And so I had a client in particular, she didn't think it was going to work for her. She's like, I'm old, and what's it going to do for me at this point in my life? And I said, let's just be patient with the process and work at it for a couple of months. And so that's what we did. And she was amazed at how she made progress with her pelvic floor. So as we age, yes, there are changes that happen, but there are tools and strategies that can be very helpful to prevent these
Mm.
issues from, getting worse. Yeah.
Gotcha. That's interesting. That is way interesting, because I would think that it would be more so women who have had babies that after that have issues with it. I remember even just as a fitness coach, having women who would try to jump rope and exercise and do these things, and they say, "Oh, I squirted on myself," And it's so it's us. We laugh about it because most of us at some point we've had the issue, or to where we couldn't hold it or balance it. And then so now you're like telling me like, no, this can happen to anyone in a quite a range. What would cause someone at 12 to have it? Would there be some type of kidney issues or something like that?
So it does depend patient to patient. There's some kids that are even younger than that do go to pelvic floor. They may have some bedwetting issues, or
Mm.
they have a nervous bladder. And so we work, I'm not a specialist in pediatrics, but depending on the child and their presentation, I can treat them. So it is case by case. I've had some that have had surgery in the past that have affected their pelvic floor, and so our goal was to help them rebuild their strength after having surgery. So it does vary from kid to kid. If it is bedwetting, if it is diet related, if it is because they've had something congenital that they've had to get treated over time through seeing doctors and having surgery. We work to just help them wherever they're at and meet them wherever they're at to help improve their situation.
So also to determine these things, you would do like some type of assessment or exam for them, evaluation for it.
Absolutely. So if they're younger than 18, I do not do an internal exam. I will do an exam. Of course, the parent is present. I'll look at the structures, but nothing will be done internally because that's typically the standard in which I perform my initial examinations. But if they're 18 or older, then we do an internal exam, and we look at the pelvic floor, we test the muscle strength, we look for tension in the pelvic floor, those types of things. Yeah.
Oh wow. So would it kind of go into like, what is that thing called when you go to the doctor and they make you urinate? And I always forget the name of that, like the little tube that goes there. So would it go into something like that too?
Like a
A
catheter.
catheter, yeah. Yeah.
No, I don't test urine when patients come in at all. We
Gotcha.
we strictly assess the musculoskeletal system.
Gotcha. Oh, okay.
So if they have something else going on where they're having urgency or
Mm.
burning when they're urinating, then we would say, hey, I think it might be beneficial for you to go to your doctor and get that checked out. But yeah,
Versus,
we don't test it.
gotcha. Gotcha. Versus an actual frequency of the. issue that they may be having. Okay, now this is making sense. See, you guys, I'm pretty sure you're out there, you're learning something right now because I'm learning as well. Just well, because you always just everything you learn, you always keep it like a tunnel vision as to what things should be and what it looked like. And now you've like painted a picture as to this can happen to anybody. These could be the reason. This is what type of things that may happen or occur in between those times. So that is very informative. So tell me, besides like getting into pelvic floor, like, you know, you've been an entrepreneur. What were you doing right before this?
So I've worked for other companies before. I've worked for hospitals. I've done home health. I did pediatric home health for a while. I've done like rehab. I've had a wide range. I've worked in nursing homes and outpatient clinics. I've pretty much worked in every setting prior to starting my own business. Most recently, prior to starting, I was working in an outpatient clinic, and I worked in a hospital. So what was nice about the hospital is that I could see patients in the hospital if I needed to. And then I also had the ability to see patients in an outpatient clinic where they would come in and they would, get treated for physical therapy, and then they would go home the same day. So it was a nice mix of both. And so I was doing that for a while. And then in 2020, February of 2020, I had my third baby. And, prior to that, I had always wanted to start my own practice, but I just really didn't know how I could do it. And so during the pandemic, I'd say prior to the pandemic, but the pandemic really helped me solidify that, you know what, this is what I want to do. And so that's what I did. I decided that I want to have my own culture and kind of create a space for women and people to come in where they would feel like where they would get healed.
Right.
Come in,
Right.
we don't just treat the symptom, but
Mm.
treat them as a whole.
I like that. I like that a lot because I'm pretty sure even when they come and get assessment, this stuff is new to them, just as it is, you know, for us listening. And because that's what they come to you for. You're specialists that specialize in this thing. And for the most part, I've seen just like doctors, you know, themselves, especially when I guess like a PCP or something like that, your primary care, they only are limited to what they're gonna view and help you for. So tell me, or tell us about like what, you know, I know you said muscatary. So what kind of exercises do we need to be doing to help us?
Yeah, so it really does depend.
Okay.
I'll have some clients come in and they'll say, I've been doing Kegels for the last 3 months and nothing's been getting better.
Right.
I don't, oftentimes I'll say, you shouldn't be doing Kegels right now. Let's stop.
Gotcha.
And so there's really not one cut and dry
Gotcha.
list of exercises for people because it does vary.
It makes sense.
Some people shouldn't be doing Kegels where some people would benefit from some type of exercise that involves engaging the pelvic floor the right way,
Gotcha.
So it varies case by case. I can more so say there's different strategies that toileting that you should, maybe not do. Everyone can benefit from that, like squatting over the toilet.
Gotcha.
No one should be doing that. Straining when you're having a bowel movement. No one should be doing that. And so those are things that globally as a people, we shouldn't do.
Gotcha.
But in terms of specific exercises, because it is such a variety of things that can happen and can go on with patient to patient, it really does vary. It really, really does vary for certain people. Yeah.
That does make sense. So what are the symptoms that someone could be having that they need to reach out to somebody like you?
Yeah. So the most common is, whenever I cough, I sneeze, or I laugh, I notice that I pee on myself. Or when I exercise, I pee on myself.
Gotcha.
And that's a very common one.
Uncomfortable.
Another common one is I feel heaviness or pressure in the vaginal area. That's another one that I see a lot in people, whether they've just had a baby or maybe there's someone who's been straining all their life when they have a body.
Gotcha.
Another example could be I have a lot of pain and discomfort with intercourse.
Gotcha.
It's not
Wow.
not pleasurable for whatever reason. That can be a problem as well. So these are the most, I'd say, common. I would even say constipation.
Mm-hmm.
If you feel yourself bloated, you're constipated, that's a pelvic health issue as well. So we
Mm-hmm.
can work at that too to help normalize and regulate someone to have good daily bowel movements.
Gotcha. Okay. And that makes sense too, because I try to tell the clients as well, like, I do gut health assessments, and that's my that's my industry. But yes, I tell them all the time too, when you having some bowel issues, I've seen people tilt a certain way. I know you know what I'm talking about. They tilt and they try, to make it come out. And I've had ladies and men that say, I think it's just not lined up right, because it's not coming out. So I totally agree that there would be something too that they would have to go into. I wanted to ask you. So, well, that was one of the things I was going to ask about, mainly about the pooping. I wanted to ask you, I know you mentioned 12-year-old and 92, but are those a frequency between women and men? Is it both, or just mainly women that you like focus on?
So my practice predominantly, excuse me, practice is predominantly women.
Gotcha.
I do see a handful of men, but the majority of clients that I see are women.
Gotcha.
So I like working with men too. And some clients will have their spouse or tell, their male partner, and then they come to see me after that. But most of my clients are women.
Gotcha. Have you seen, because I've been in the fitness industry forever, and I find it to be kind of difficult for me to watch a lot. I've seen where women and men strain themselves with exercise, weights, and such. And what I've noticed is that they'll come to me and say, "Hey, do you think this is an issue that is prolonged due to this, this thing that I've been doing?" And I found it that most of them urinate on themselves, have bowel issues, and all this stuff, and they can no longer carry themselves. Have you seen that?
So I've seen where people do a lot of strenuous weightlifting, and they'll notice more so like heaviness and pressure in the perineum. Like, oh, it feels really heavy down there. And so we work to normalize their posture so that they're not a lot of pressure on their pelvic floor. So I've seen cases like that. And some people I say, hey, let's stop the weights for a little bit, regulate your posture, look at some ways to better lift, and then we can go back into
progress from there. Yeah, because I'm looking at videos to where I know it's uncomfortable, and I can just imagine, like you said, the pelvic floor being just deteriorated over so much strenuous, things on a regular. And I've seen it to where it's men. It's actually not a lot of women. So that's why I wanted to ask, have you even seen something like that? Because I've seen it a lot. So so pretty much when I come into the office and I don't know that these things have happened to me, have you had some ladies or men to come to you and they don't even have no clue that they have pelvic floor issues?
Well, usually when they come in, they'll know that something is going on.
Gotcha.
Either someone told them that they should see a therapist because they've been complaining of something, or maybe their physician, their PCP or OBGYN referred them and said, hey, you have this issue, you should see a pelvic health therapist. So usually they'll come in with some
awareness.
And then when we go through the assessment, I may assess and notice other things that are going on that they may not have had an idea about, but they typically know. They typically know something is going on. And then my job is to find out why it's going on. And if there's other things that are there, then we talk about it for me to be able to help them um, address those issues as well.
Gotcha. That's a big deal because that would be to me. I have a family member that had that issue, and I don't think she was aware or had any knowledge of like a doctor like yourself to even adjust her. And I think she still actually deal with it to where she's taking medication. And I know with even just being a specialist, do you prescribe medication or would it just be a therapy to where they would actually go through to get better?
Yeah, so I'm not a physician. I'm a doctor of physical therapy. So I work primarily through exercise, and I
Right.
work through, teaching patients how to use their body in an appropriate way to help support their pelvic floor. With my functional medicine services that I do as well, where we work to, really find out some underlying things, I can recommend supplementation,
Mm-hmm.
but typically I only recommend supplements, no medication, because that is not
Right,
our
right, right.
practice.
Right. It's not in your I was thinking that too. I was just like, wait a minute. Because when she's been taking this medication, which have caused other issues. It just have. And it's just because she's unaware. Maybe we hadn't seen a doctor like that, like you out here, at all.
Yeah.
And the doctors aren't recommending it. So that was one of the issues, and she's still having it. I remember, like, I just actually just remember that she mentioned this just here recently that she was still having these issues, and the medication was only doing so much. And that's the reason why I asked, like, do you recommend that? Not necessarily just like distribute it out to, your clients or your patients, but even just like recommend, like, hey, is this severe that you may need this medication?
Yeah, so even in that, I couldn't do that in my scope of practice as a physical therapist to say, oh, this medication might be something that you should think about. I can't even really do that.
You know what I'm saying? Like if they're already on medication, like, keep that medication going, but we're gonna do.
So I pretty much tell, this is kind of my standard. I say, if your doctor recommended it, then continue with it.
Gotcha.
And if you want to get off, then talk to your doctor about it. If
Gotcha.
your goal is to wean off, we can do whatever we do with physical therapy. But in terms of should you take it, should you not, I leave that to them and their
That's
doctor.
right.
But even though we have an understanding that, I would like to get off my medication, then I say,
Gotcha.
that's a goal, let's work towards that. But ultimately, for them to pull the trigger of not taking it anymore, then I let them discuss that with their doctor.
Gotcha. That makes total sense. Yeah, because I feel for those who only have to stick with medication, even in any kind of illness, like any illness, to where you have to constantly deal with it. I have people that say, hey, I have diabetes, but I'm taking the diabetic medicine and this is what happens. And that's what's happening. It's always a cause and effect. It's never like a balance, to where, oh, I'm getting better. Like you said, I like the fact that you're doing the therapy part of it, because doing therapy is just like, even if you were an athlete and you hurt yourself, you can take all the medications in the world, but if you don't get up and do something to, kind of build whatever it is back up or help that problem, then it can still stay the same.
Absolutely.
Or even worsen.
Yeah, absolutely. Yeah, absolutely. Yeah.
So yeah, that's what so this is new for me. Like I mean, I've had babies, and I know when my doctor always tell me, well, I have the same doctor. I had my two babies, and I was just excited just to hear that he said, you understand the pelvic floor, and I did not. It was just the fact that I knew that if I pushed at this time, there's a wear and a tear, and we don't want those issues.
Yeah.
So it's totally different.
Yeah, absolutely. And it's good when, I have pregnant women that come in. I love when they come in when they're pregnant because we work together to help prepare them for
Mm.
delivery. You know, how do you push without
Mm.
up your pelvic floor? Um, what positions are best for you to labor in? And how do we make sure we stretch out the perineum so that you're well prepared for delivering the baby? And so when women come in during pregnancy, I love it because when they message me and say I had the baby and everything went well, that's really rewarding. You
That
know,
is
you prepare
rewarding.
your body to be able to deliver a baby. And then they come back postpartum, and
Oh yeah.
I don't need to see them as much because we've done all the work before.
Right.
Their aftercare is not as long or as
Mhm.
extensive because they've done a lot of work beforehand.
Beforehand. Now that's a good thing. So that is awareness and preventative, like all in one. That is so awesome because I'm telling
Absolutely.
you, yes, that is good to hear. So ladies, if you are pregnant right now, we need you to go out and see Dr. Bailey so you can keep those things up intact because I know how important it is when you're in that labor and most of us just want to push. We just want to get it over with, but there are consequences and issues that you can have behind it. I've seen women that went into shock because they pushed too soon or, had pelvic floor issues. So that was one of the reasons why, Dr. Bailey, I really wanted to get you on the show because I knew like even pelvic issues itself, women don't know that makes them carry weight. Yeah, if you can't go to the restroom, do number two regularly, you can be holding that weight there due to having pelvic floor issues. Something as simple. There was a dance style that I used to teach. I'm not going to mention it. That helps the pelvic floor. And a few of my clients lost 20 to 60 pounds, almost just less than a year, just because they were working on the pelvic floor. So I know with the actual therapy, that would just be amazing, for something, even I feel like every woman should just go to, even if they didn't have kids, if you done some type of strenuous exercises, if you were, athlete like how I was, I felt like that's important just in general, just to go get checked out. You don't know if it's something that may, happen later on. And you need to go see Dr. Bailey. You
Yes,
need to
we'll
go see Dr. Bailey. Yes, for a fact. So that was just it was interesting to me. So it kind of correlates with my story. Not only just because you have kids, but because I was an athlete, because I felt, some lower pains and stuff like that. And even getting to like cysts and fibroids and all those issues, when you don't have that actual blood flow and it's congested there, people don't realize that that's got something to do with the
yeah,
pelvic floor as well.
absolutely. Absolutely. It's everything's all connected, you know? It's all connected. Yeah.
And that's what was important. So that's why I was like, let me get her on the show so she can explain these things to us as to why our bodies are dysfunctioning like this
Yeah.
and why we would need to come in to get checked out. Again, like I said, as a specialist, as a therapist, it just producing the therapy for us. It's special. It's not like something that you would see regularly or even hear of. Have you heard of anybody in DFW like doing what you do in DFW?
Yes, we have a
Really?
yeah, there's a community of therapists.
Really?
I mean, we're not
Interesting.
I wouldn't say we have an overabundance.
Gotcha.
It is a growing field, and
Mm-hmm,
there are more therapists that are available, which is good. Because there's plenty of women and men that need us.
mm-hmm.
So to be able to see it growing as a profession,
Mm.
able to support our community with these services, I think is amazing. Yeah.
Keeping up the awareness. So I have one last question. Well, not the final last question, but one of the last questions that I was thinking about therapy in general. What do you approve of? The little holders for the bellies when you're pregnant, and they have those little belly holders that they say they're supposed to help with the pelvic floor.
Maternity belt
Yeah,
or
like a little maternity belt. Mm-hmm.
yeah, so I will recommend that for some clients,
Oh,
especially
okay.
if you're having increased pelvic pain
Mm.
or abdominal pain, just to kind of help offload some of that
Mm.
pressure. I will recommend some type of belting or external support for clients. Now, like waist trainers, postpartum, that's a little bit different. But in terms of maternity care and wearing a supportive belt, I do recommend that for a lot of my clients. Yes.
Gotcha. Yeah, because I never use it, and my babies are not small; they were huge. So I always say that I may have some pelvic issues.
Yeah.
They were so big, and luckily, well, I'm pretty sure it's still something there going on, but not, of course, to where I can see it or notice it. But it must be something that you can very much so, indicate like this is your problem. But I've always been concerned about that. So, ladies, if you're carrying those big old babies, that this is what you need to know. I'm telling you because I just would have never known. Like you hear about the doctors, they give you a little piece of paper that tell you the exercise you do before and afterwards. But most of the time, it's just like you said, a Kegel or a little crunch or two. But actually going through a therapy process, I think that would be beneficial for. I'm not gonna lie, like all of us. I think we all should be evaluated. So it's
Yes.
just like. Yes, I'm gonna put you out there, Dr. Bailey, because I think we all need to be out there. Look, I'm waiting for the information so we can share it with the public so they can come and look you up
Yes.
and
Yeah.
find you. And I mean, even if it's just like I said, the awareness part of it, taking the precautions. A lot of women also that I've seen have hip issues, and I know you can relate to that. My doctor said most women, you know, the hip bones start deteriorating, real fast after, they age. You wear heels on concrete ground. We do all this stuff. And that is also, too, is what he told me, a pelvic issue.
Yeah. So the hip attaches into the pelvic cavity. So we look at hip mobility too.
Mm.
Huge role. It can't be ignored because it does affect the functioning of the pelvic floor as well. Absolutely. I completely agree. 100%. Yes.
And that's because I wore heels all the time on concrete ground. And he told me, you better stop.
Yeah. Yeah.
He's like, you have to stop that because you're going to wear and tear your pelvic and your hips. And he said that's the first thing that goes for women. So just think, if you're out there listening right now, if you just think that if you have pelvic issues and hip issues, that's like right where you have to walk and stand. Those it's the function of function. Like you have to keep. That's something that's supposed to keep you going. How are you supposed to keep going if these things are going? I mean, it's all messed up.
Yeah. Yeah. It's only going to get worse over time, which is why it's important to seek help, to go and be proactive. Even if you have just go to one visit, and you just want to get assessed. Maybe you're not really having major issues. It's good to just come in, get assessed, see what's going on. That way you can know what your body's doing and how you can help optimize your pelvic floor so that you're not having these issues progress and get worse over time.
It get worse over time. Did you hear that? Get worse over time. We do not want to have issues that get worse over time, especially when we have Dr. Bailey here. This is going to give us all her information so we can all go get assessed. And
Yeah,
we don't need to wait until the new year. We need to jump into it before the new year. So, and this is also how I do my evaluations and assessment when I was a fitness coach. I don't care to do fitness that much no more. I love what I did for 20 years. It was great. It was wonderful. But like you said, the mobility. And so when these women have these issues, it was certain exercises that they can only be attended to. And they wonder why. Oh, well, I'm used to running. Well, I'm used to doing this. Well, I'm used to doing that. Well, these things are going to cause and affect XYZ.
sure, sure.
So before you get into your plan, your fitness plan, I'm a new me, for the new year, I would like for you to go and get your assessment. And for assessment, what is your prices?
So they do range because I do
Gotcha.
have a hybrid class. I do have a hybrid practice. I do self pay, and I also take two types of insurance: Blue Cross and
Oh, gotcha.
Medicare. And then I offer packages. And there's a sliding scale for clients, and there's telehealth. So it does vary from vary from patient to patient depending on what they're coming in with.
Mhm.
So I would say the best way, if you want to just do a discovery call with me, I offer free 15-minute discovery calls
Oh, nice.
where we can hop on the phone and we can talk about your symptoms, and I can share with you if physical therapy would be a good fit for you for pelvic floor. And then I can share what prices you would need depending on what's going on and where you're located. I do work with patients virtually as well, so it's not
Mm.
just um, in person. But I do offer the free discovery calls with which people take on. And so to access that, you could either book it on my website, which is www.360hws.com. That's www.360hws.com. Or you can go on my Instagram page at 360 underscore health coach. And if you click the link in the bio, you can book a free call and we'll chat and we'll be able to find out what's going on or talk about what's going on and provide you with some insight as to if pelvic floor physical therapy would be a good fit for you or not.
That is amazing. So look, she just shouted herself out. She just told you where to find her. Are you on Facebook too?
I am. So my Facebook page is 360 Health and Wellness Services.
Gotcha. Okay.
Yeah.
Okay. So you got the website. You found her. You can find her on Facebook. You can find her on Instagram. Find her before you get into these new year plans. Trust me, you're gonna benefit from it, and especially if you're a woman, benefit from it. Especially if you want to lose weight, I'm recommending. Like if I recommend it, then you guys should know. If I'm recommending you go there first, because I'm gonna ask. I'm gonna start putting it on my questionnaire. I recommend it, Dr. Bailey, for you to go get these things checked out because it'll help me assess you a lot more too, for as far as your mobility and even just tracking where you are with your pelvic health, so we can help your gut health. All of that goes together. So I
Yes.
love it, and I appreciate you a lot for coming on to educate us. You see, I had my curious eyes on. I had my questions.
Yeah.
I
Yeah.
was curious myself because even though I've been in the industry, I know a lot about pelvic health and all these different things. But this is what you specialize in. When somebody specializes in, I tell people all the time, you want to go and check them out because if they specialize in it, this is something that they can help you thoroughly and through.
Yes. Absolutely. Absolutely.
Thoroughly and through. So we will be checking back in because I know you're gonna have some events coming here. I missed an event, I think a couple of months ago that you have. So are you gonna have any more events coming up soon?
No events for the end of the year. Events for the end of the year. We're starting to plan for first quarter of next year, but we have nothing solidified
Mm,
as of yet.
gotcha.
Yeah.
Nice, nice. Well, if you go and follow her and check her out, then you'll be able to have that information up front with yourself. So definitely go get assessed. Definitely check her out. Definitely support, if anything. And again, thank you, thank you, thank you for coming on the show. This is a Wellness Plug TV, y'all. So definitely go to NadyaByNature.com and check out the ebook and pick it up for your gut health. You know you need some good health. That's what we all need. And we're all trying to build a wellness community. That's what we have people like Dr. Bailey and other doctors that come on, and even celebrities. We want you to be aware of who you are, what you do, and what you're doing in your life. Because as an entrepreneur, sometimes we can fall short. So we all want to make sure that we're doing our part with being a good steward of not only being a good entrepreneur and helping our community, but we got to help ourselves.
That's right.
Tune in. I am excited. Thank you so much again for coming on, and you guys have a blessed night.